It's Amanda Bobbett here, and today I'm so excited. I have a gentleman that I'm so honored to be able to interview, Dr. Horst Filtzer. Now, Dr. Horst Filtzer is the medical advisor behind Enagic. And so, Dr. Filtzer, would you mind telling me a little bit of background on where you came from, how you got into Enagic, and your education?
Well, let's say I'm an immigrant to this country. I was born in Poland and lived in Germany until I was 16, and then arrived in Fargo, North Dakota, of all places, which was quite the culture shock. But I graduated from college in North Dakota, University of North Dakota, and went to medical school in Boston at Harvard. And basically, once I started there, I did my internship and residency there, and my fellowship there. And I did serve for 2 years in the Republic of Vietnam. And when I finished in 1973, I became the assistant director of the Department of Surgery at the Cambridge Hospital, and basically stayed there my entire surgical career until I was 65, which was a few years ago, and retired. And I had bought some property in Arizona, northern Arizona, and decided to retire there. As soon as I retired, I found out that it's not what it's cracked up to be. I was restless, so I went back and practiced surgery in Bullhead City in the area for about 3 years, and then actually for health reasons, I had a disc in my neck and stuff. I stopped doing surgery. I now am a wound care doctor. I'm the director of the Wound Care Center for Western Arizona Regional Medical Center. And I came upon Kangen Water quite by accident. I had done an aortic aneurysm operation on a man who turned out to be at the University of North Dakota the same year I was. I didn't know him, but we sort of had a bond. And he lived in Las Vegas. I wanted him to stay in the area for a few days after the surgery, so I let him stay at my house. And he brought this machine to my house, and I said, "What the hell is this?" And he hooked it up, and he gave me some of that water to drink. And not being really into water, it amazed me. It had a different feel to it. It had a different mouth feel. It went down easier. It also didn't seem to bloat a person. You could drink quite a large volume of it. And so I inquired about it. The rest is kind of history. I got interested in it because I could see that it had an effect. I didn't know anything about it over the long term, but I bought a machine. And not with the intention to be a salesperson or anything like that, but I met several people. They said, "Well, Doc, you ought to maybe make a DVD or something to see, that you can convince other people to use the machine, buy the machine." So I did. And much to my surprise, people liked it. And then I met Fred, I think, about 2008, 2009. And went to one of the CYL meetings, and then they asked me if I would be interested to be the medical advisor. They had Dr. Shinya, who actually is an internationally famous surgeon, and I actually knew him, as their advisor, and I said, "Well, gee, it'd be great company, and he's a highly respected man." Mm-hmm. And that's what I've been doing ever since for Enagic, but I still work full-time as a wound care doctor, and I actually like it very much.
Awesome. Well, we definitely appreciate everything you do in Enagic and for the community and the world as well. So thank you for that. So today I've got some questions that I want to ask Dr. Filtzer. And so the first question that we get from a lot of people would be, how does Kangen water affect the pH of the stomach?
It actually doesn't.
It doesn't?
No. Look, the pH of the stomach at rest is around 3.5 to 4. There's virtually no free acid in the resting stomach because the resting stomach is covered with a mucus coating, and it takes certain stimuli for the stomach to secrete acid, the most powerful of which is meat. And alcohol is a powerful stimulus. When you put that in your stomach, the stomach secretes acid. If you drink water, Kangen water or any water, it will not create an acid response because that's just not necessary, right? It doesn't have to digest anything. Also, Kangen water is much more absorbed in the antrum than ordinary water, so it's actually absorbed from the stomach. So when you drink a glass of Kangen water, that goes right into your bloodstream and is absorbed, that way, with virtually no change in the pH.
Wow. So would you say it'd be better for you to drink water on an empty stomach then to get the full benefits?
Yeah, I think if you mix it with a meal and so on, then of course, of necessity, there's acid in the stomach. And certainly if there's a high acid level, remember, the Kangen water is not a stable compound, so it doesn't take very much to neutralize it, not very much acid. So generally, it's best to drink it, on an empty stomach.
Well, great. Thank you for clearing that up. So a lot of people, when you go online, there's some so-called experts online that say, oh, you got to be careful. You're going to get too alkaline from drinking that water. It can throw your whole body's pH off balance. So can you speak a little bit on that regards?
Okay. Let's talk about the osmolality or the concentration of sodium specifically in the plasma. It's around 140 milliequivalents of sodium. Okay? Tap water, and then again Kangen water, almost never reaches 100 milliequivalents. So the water you drink is hypotonic, in other words, has less concentration of sodium than your plasma. So the more you drink of that, the more you're likely to dilute your plasma or serum sodium. When that reaches around 120 milliequivalents, symptoms and problems appear. Cardiac instability and arrhythmia, seizure disorders, and you can actually kill yourself with it. Water intoxication, that's what it is called. So before your pH would even change remotely, you'd be dead of water intoxication,
Right.
without any alteration in the pH. Also remember that your lungs and your kidneys can concentrate urine or exhale extra CO2 so that the pH balance is maintained.
Okay. And some people will say, well, what about the blood pH?
Well, the blood pH is one of our most tightly regulated parameters, okay? And because Kangen water has a pH balancing property through its ORP and its electrical activity, it can neutralize or reduce acidic pH. But to make it alkaline, it never gets quite up that high. It just hasn't got that ability because the body can blow off the carbon dioxide or concentrate the pH through the urine. The other thing is Kangen water is unstable. From the moment you get it into your glass, it starts to decay in electrical activity. That's why it's best drunk right out of the machine. Mm-hmm. It will last for a couple days or so, but the ORP will drop steadily, and then of course you lose the benefit. But in some respects, that is a good thing. For example, in my wound care practice, I use strong acidic water. Now, when I put that on a wound, it won't do any tissue damage. It'll kill all the germs on the surface, but it won't do any tissue damage. Whereas a compound like Dakin solution, which is a hypochlorous acid, over time will do tissue damage and really be a problem. You can't use it for over a long period of time.
Wow. Very smart man we have here. What's the difference between alkaline and alkalized water? There's some confusion when people go out on the internet, I feel, about the two differences there.
Well, alkaline water is a stable, buffered water. It has no electrical activity. Well, it has some. It's very minor, minimal. And as such, it is buffered internally, and so it requires equivalent amounts of acid to change the pH. Alkalized is produced by the electric current, and it is just what we're talking about, the unstable kind of water.
Is it possible that if someone were to make their own alkaline water, let's say they put a lot of baking soda or other forms of chemicals in their water, could they in fact become too alkaline from that type of water?
Yes.
Yes.
There used to be a thing called the milk alkali syndrome in the days when peptic ulcers were treated with antacids and with milk and cream, so-called sippy diet, before we had H2 blockers and other proton pump inhibitors and so on to reduce acid. And people would be taking huge amounts of calcium carbonate and all kinds of alkali, and the next thing you know, their pH would creep up to 7.6. They got into trouble.
Wow.
Yeah.
And so because this is alkalized for electricity, we're not adding things, there's no concern about over alkaline in your
Correct.
body.
Exactly.
Awesome. Great. And women that are pregnant, I know when I went through my 2 pregnancies, I had such a benefit from drinking the water. Is it okay if pregnant women drink Kangen water?
Well, you just told us.
I know, but we have the medical advisor here.
Oh, absolutely. There's
Awesome.
no downside to that. We sort of say infants don't need it because they are so perfect, and their metabolism is governed by these huge factors, maternal factors, immune factors they get from the mother, and so on. By the time they get to be toddlers, maybe then they might benefit, but it would be unnecessary before that. And again, once they walk around, once they're active, there's no downside to giving them the water.
Awesome. Good. Kidney issues. Some people are going to be taking diuretics, or maybe they have one kidney that's not functioning. Is it okay for them to drink the Kangen water?
You must remember that most of all, Kangen water is water, okay? And everybody needs to drink water. People with kidney issues, specifically chronic kidney failure, like there's 5 stages of it, where you start having slight impairment of your kidney function to the point where you can't have any functioning kidney residue at all. And here the caveat is that you have to watch your volume. A sick kidney with a low glomerular filtration rate can only filter so much urine. So if you overpower the filtration rate with an excessive amount of fluid, you're going to get into trouble. You're going to get into heart failure and so on. So it's not the water, it's the volume.
Right.
People on dialysis can drink Kangen water. In fact, there's a pretty good theoretical benefit. Actually, not theoretical, a real benefit, because the water is able to adjust pH. Chronically acidic people, like in renal failure, benefit from that, and it improves their sort of general sense of well-being. Doesn't cure the disease, but it makes them a little better. In some places, they have been using ionized alkaline water in the dialysis bath in conjunction with the minerals that get put in there to dialyze people, and they seem to get better dialysis runs for the patients with that.
Wow, that would be fantastic if we had something in the U.S. that was doing that. All right. What about the benefits of people that are on chemotherapy?
Well, I want to make it clear, I am not saying that Kangen water has a direct benefit on chemotherapy per se. However, there used to be this business that because antioxidants shouldn't be used and so on, that people would dissuade people on chemo from drinking Kangen water, and that's patently false. Those studies have been done. You can take antioxidants and not affect chemotherapy. I have found empirically, I have a large number of patients, primarily women, because we have a fairly active cancer center where I work, and we have a lot of breast cancer. And these ladies, depending upon what stage they have, they may get chemo, they may get radiation, they may get both. Now, when you give these folks Kangen water steadily every day, and they drink it, they have less nausea, vomiting, and side effects from the chemo. And this is, I haven't done a formal study, but this has been told to me by innumerable patients. And so again, there's no downside to it. You've got to drink something. why not drink something that make you feel better? And then on the radiation side, I see a lot of women who are fair-skinned, and the fairer your skin is, it's just like the sun. You should go out in the sun. Radiation affects you. They come in, they have these burns on the chest wall. They're painful, sometimes even blisters. You take that strong alkaline water, 11.5 pH, put a towel on it, put it on the chest wall. It's amazing how quickly it relieves the discomfort. And they can go on and tolerate and finish their course, whereas otherwise they might not get the full benefit of the radiation.
Wow, that's powerful. What about people with inflammation in their bodies? A lot of people, maybe they have the itises, the arthritis, bursitis, tendinitis, those type of things. I've noticed just from giving out the water that these people get a tremendous benefit. Can you explain why that might be?
Well, we have recently, on behalf of Kangen USA, done some studies. First in tissue culture, human red cells and human white cell tissue culture, and have demonstrated there is indeed a significant antioxidant effect to the water. One of the problems with prior claims about that was that we couldn't prove it because there were limits to the testing modalities. Consequently, I was able to find a laboratory that had a unique proprietary test and was able to test the water in a tissue culture medium and prove that there's not only an antioxidant effect, but the inflammatory response of neutrophils is subdued by the water, so it's decreased. So you have antioxidant, which is good against inflammation, and you have a reduction of the actual inflammatory response, which is another benefit. So, we need to do actual studies on people and prove that it does. But from what we know now, there's no question it has antioxidant and anti-inflammatory properties. We've done a study with 13 participants who were exercised heavily while drinking regular water over a 3-week period, and then drinking Kangen water over a 3-week period. And we found that in the group with the Kangen water, they had an elevation of the red blood cell count when they were drinking the water and were subjected to stress, i.e. exercise stress, okay? And then at the same time, they would have an increase in the oxygen carrying capacity, right? Because the more red cells, the more hemoglobin is in circulation, the more oxygen can bind to it. And we also found that their white blood cell count is depressed over the regular water group, which means there are not as many inflammatory cells out there in the periphery to lodge onto a joint or to a nerve or to a ligament and cause discomfort and so on, and inflammation. And that also has been sort of proven in the subjective response of these people. The ones that drank the Kangen water, well, they all drank the Kangen water at some point, but they found that with the Kangen water, their recovery from the stress of exercise was quicker, and their overall discomfort during exercise was less. And those are psychometric tests, but they're valid. I mean, they've been proven as appropriate by the literature. So I think this is a beginning. We have plans to test about 30 or so cytokines, which are messengers within the cell that can help the immune response, can help subdue inflammation, and in some cases cause it. But we want to know who does what and with which and to whom.
When you do research Kangen water, there's one site in particular. It's a Chem One. It's this gentleman, snake oil on tap, and I feel like I've lost a lot of people to that internet and this gentleman making very untrue claims out there on this water. Do you know what one I'm talking about out there and what he's saying?
Yeah, I don't want to insult anybody, but the man is a dolt. The claims he's making, he starts out by saying water cannot be ionized. Well, look. Yes, H2O, 100% pure, distilled water can't be ionized. Actually, what happens when you pass an electric current, you get hydrogen and oxygen. But there is no such thing as that kind of water on the planet. All water has minerals, and seawater has, a horrendous amount, but fresh water even, and so therefore it can be ionized, and minimal amounts of hydrogen are produced, but the main thing is that you've got a lot of negative and positive ions floating around whichever end of the electrode you're on.
So he's really,
Well, I don't want to get into name calling and stuff, but suffice it to say, he got fired from his university post.
well, that's good to know. Thank you for clearing that up. Well, thank you, Dr. Filtzer, for being with me today. I'm excited for everybody to see this this video here, add some more value to people's lives. So thank you again, Dr. Filtzer. Appreciate you.
My pleasure.